Dr. Jasmine Yee. Jasmine is a postdoctoral research fellow in the School of Psychology and an academic fellow in exercise and sports science at the University of Sydney. Her research interests are in the role of exercise and physical activity for people with cancer to improve physical and psychosocial well-being. Welcome, Jasmine.
Thank you, Patrick. And I'm really pleased to be wrapping up our formal presentations this evening. I think it's quite nice to end on exercise. It's something that crosses many of the different areas that we've discussed this evening. So we've heard about lots of different side effects that are related to cancer treatment and impact on someone's ability to work with or following cancer. Some of those issues being the cognitive issues, the psychological or emotional toll that cancer can have, those physical effects. And I think largely one of the symptoms that crosses across all of those domains, which was flagged earlier as being one of the most distressing and persistent symptoms, is really fatigue. So it's really exciting that we have effective strategies to manage these different side effects. And one of the most effective strategies is exercise. So exercise is a really safe way that can support your well-being and plays a really key role in your ability to return to work. So we should all be doing exercise, whether we have cancer or not, but what should you actually be doing? So the key here, particularly for people with cancer, is to avoid inactivity. So that means minimizing the amount of time that you spend sitting or lying down. And this might be something really simple to start with, as when you're watching TV, when the ad comes on, get up and walk around for a couple of minutes. As Liz mentioned, it's really important to tailor exercise to the physical demands of the job and the requirements of the task that you're having to complete. The exercise programs are largely tailored not only to the physical demands, but also with consideration to your personal circumstances. So thinking about how you're currently affected by symptoms, what your current physical activity level is. Do you have any of those limitations, for example, lymphedema, which might impact? And also thinking about responsibilities outside of work as well. So are you caring for young children or other responsibilities that might impact the different goals that you would have around exercise? So a tailored exercise program is really ideal and what we would recommend for people with cancer, but we do have some general guidelines that we can work towards. And it's important to remember that these guidelines are not appropriate for everybody. They are largely dependent on your individual circumstances and the goals that you're trying to reach. The guidelines are a combination of both aerobic and resistance training, which gives us the most comprehensive exercise program. Aerobic exercise includes activities that get your heart rate up, so activities like walking, and our current recommendations are to work towards 150 minutes of moderate intensity aerobic exercise. So that includes activities that you can complete and at the level where you're starting to not be able to carry on a conversation anymore. So that's a good way of gauging a moderate intensity activity. The other component of those guidelines is an alternative 75 minutes of vigorous activity. So that would be activity where you're really huffing and puffing and quite short of breath throughout. Resistance training, which we sometimes might refer to as weight training or strength training, we recommend to be done 2 to 3 times per week. But again, I reiterate that these goals are not necessarily appropriate for everyone, and it is important to work with an exercise professional to try and determine whether this is appropriate or whether there are other individualized goals that are more suitable. So what type of exercise? When I talk to people about exercise, often they say, I don't go near gyms, I don't do gyms. And that's often the first image that springs to mind when we start to talk about exercise. But the good news is that Gyms are great for some people really enjoy them. But for those of us who don't enjoy the gym, there are lots of activities that we can contribute and participate in that are not in that very structured environment, but do still count towards exercise. So for aerobic activity, that includes things like walking, cycling, swimming, or acroaerobics. Anything that really gets your heart rate up would contribute towards that 150 minutes of aerobic exercise. For resistance training, there's activities that can be done at home. Normally we picture these being done in a gym with quite sophisticated and expensive equipment. The good news is though, if you have a wall, you've got a space where you can start to do some resistance exercise. There's also some very simple equipment, such as dumbbells, or what we call these resistance or therabands. And they can be done to simulate similar types of exercises that you might do in a gym, but still obtain a similar benefit doing them at home. So given the significant impacts of fatigue, and I think we've heard about fatigue through all of the presentations this evening, I thought it was important to focus in on that a little bit. So when we think about fatigue, generally we have a natural inkling to rest. And if we have a look at this pictorial here, which is describing this cycle of fatigue, what we see is that fatigue often results in sedentary behaviour or a decline in the amount of physical activity that one does. Now, what happens when we reduce our activity is that we actually end up undergoing physical deconditioning. So we lose some of our muscle and we lose function. And because we have those then physical deconditioning and those deficits, it actually means that we become more fatigued. So we enter into this cycle where the fatigue makes us want to rest, but the rest makes us more fatigued, so we want to rest more. But there is an effective strategy that can break this cycle of fatigue, and that's exercise. And exercise is actually one of the most effective strategies for managing cancer-related fatigue. So when you're not feeling well and you're feeling fatigued and tired and run down, often it's hard to initiate exercise. So I've got some tips here, and quite interestingly, they mirror some of the tips earlier around cognitive fatigue as well. So really thinking about what is the time of day where you have the most energy. If you bound out of bed in the morning, then perhaps that's the best time of day to then plan to do some of that exercise. Also think about breaking up exercise into shorter intervals. If you plan to walk 20 minutes a day, you don't have to do that exercise all in one single 20-minute block. You could consider breaking it up into 2 10-minute walks if you think that that's more achievable. With exercise, we don't need to be doing it in long bouts for it to be effective. It's just as effective if we do them in shorter intervals as well. Another strategy is to keep a fatigue diary. So when you do start commencing to do some exercise, is keep track of the type of exercise you do, how long you do it for, how hard you think that exercise is, and track how your body feels in response to that exercise for the rest of that day and over the coming days. And what you might be able to see through documenting that is perhaps a trend towards the type of activities that you respond better to with respect to fatigue. And it might identify some activities that perhaps are best avoided. So generally getting started with activities like walking is okay, but we would recommend that you do talk to your doctor before you commence or embark on an exercise program. If you're after a little bit more help and some of that tailored advice that I mentioned, the best allied health specialists to design an exercise program for you are accredited exercise physiologists or a physiotherapist with expertise in cancer care. I've got a couple of links there for you which allow you to pop in your postcode, and they do locate the closest ones to you, or you can search in whatever area you do like. Cancer Council also have some excellent resources. If you do a quick Google for Cancer Council and exercise videos, there's some great videos on there which take you through some exercises that you can do at home with resistance training. For example, I said if you've got a wall, you can do some resistance exercises. So there's some example of wall push-ups, which are a good exercise to start working your upper body. So you can have a look at that there. That's a good place to go. There are some other programs in the community, one of them run by Cancer Council called Enrich. And there's a list on the BCNA website of exercise programs available. So unfortunately, these aren't too useful at the moment because a lot of these programs are currently on hold due to COVID-19, but they will hopefully be a good resource going forward and thinking about once things get more back to normal in the future. Thank you.